And for more on the situation in Gaza, we can welcome Jay Matthews, who is an operating theatre practitioner with the medical humanitarian charity UK Med. He returned to Gaza earlier this month to work in the territory's hospitals, having previously spent 5 weeks there in early 2024. Good morning, Jay. Thank you for joining us. You're just back in Gaza a week or so now. Can you describe the situation there in the hospitals at the moment?
Sure. So it's a lot worse than it was when I was here a year ago. The situation has become more dire. The area is much more crowded now. Supplies are much lower. So it's much more difficult to provide the aid that we'd like to the people that are coming to see us. This, as a contrast from last year, I wasn't aware that it could get much worse, but it certainly has.
And there's been practically no aid getting through to Gaza for the past 2.5 months. And from a medical point of view, what are the supplies that you've noticed have been most sorely missing in Gaza's health facilities?
It's simple things, really. Simple consumables like gauze and swabs for operations, dressing and bandages for patients that are coming in with wounds that need changing. These sort of things are crucial to maintaining healthcare for people, and they're sorely missed. And you, as a healthcare professional, you don't always think about not having them, but here it's a real, it's at the front of your mind every day.
And you mentioned earlier that compared to your last time in Gaza last year, things are much worse now. What are the main differences that you've been noticing?
A much higher volume of people coming through our doors. So we're seeing hundreds and hundreds of people every day through our facility, the UK Med Type 2 hospital here. We're seeing worse injuries as well. So a lot of explosive and gunshot injuries, which is pretty troubling for us, and also the reduction in aid. So the fact that we do have a lot less equipment, a lot less consumables, is making it very difficult to provide that humanitarian aid. So before we were seeing slightly less people, and we were seeing we had a bit more in terms of reserves in humanitarian aid and equipment.
And the war has, of course, produced a massive number of wounded to be treated, as you've alluded to there. But what about more mundane medical interventions, which still continue during war? How have doctors and other medical workers been managing with those?
So we have a public, a PHC, a public health centre here that sees up to around 800 people a day in providing different treatments and supporting people as best we can. Those are, like you say, the essential day-to-day healthcare needs that people require. I think there's been a real effort to make sure those needs are met as best they can be. Sometimes with restrictions, you have to be more creative with your management of patients, and you have to change your guidelines. But I think on the whole, the people have been really understanding here in Palestine. And
witnesses from Gaza have described how it's almost impossible to access clean drinking water, for example, and other such things, with the sanitary problems becoming really, really difficult. How has that impeded the work of doctors and nurses in hospitals?
Yeah, it makes life incredibly difficult for everybody. When you're trying to keep patients clean and wounds clean and maintain health in terms of like drinking and eating, it's incredibly difficult to when people don't have access to simple things like drinking water. It makes life incredibly difficult. We're very lucky that we have a good logistical team here and WASH team that really support us in making sure we meet the needs of the people that are coming in both their social values and their healthcare needs. But it's something, again, we have to be so mindful of every day about what we use and how we use it to make sure things stretch as far as possible, but we provide the healthcare that people need, good healthcare that's needed here.
And you have worked as a medical worker in other war and emergency zones. How does Gaza compare to those?
Obviously, every location is different. Everywhere has its own problems and issues, but here it's not really comparable. There's the need is so high, and the space so small, and it's just so very difficult. It's probably the worst situation I've been in terms of places overseas, in terms of needs for the people and the aid that we have to provide for those needs.
And how are your Palestinian colleagues dealing with what is clearly a very trying situation?
I think I don't know how to describe it really, but they're just very impressive people. I don't know how they manage to still pick themselves up after being displaced so many times, after losing family and friends, and they still give their time and their efforts and resources to help other people and to help those around them. Their generosity and kindness and work ethic is very humbling, and I feel very privileged to be here with them. I think they manage by knowing that helping others is the right thing to do, and they do a fantastic job working against the hardships that are against them here.
Thank you very much for that, Jay Matthews, who's working as an operating theatre practitioner in Gaza for the charity UK Med.